The COVID-19 situation in the country clearly not in control. India has reported the highest daily coronavirus cases in the world for the second day running now. Nearly 97,000 new cases were reported in the past 24 hours, a day after India crossed a lakh of cases mark. This means that over the next 2 days, India has averaged 1 lakh cases per day. 446 lives lost, and that was reported just in the last 24 hours, down from what we saw on Monday. But the average daily deaths, again, highest in 4 months. Now, this is now drastically the situation that has changed, and there is about 5.9 lakh cases in the last 7 days compared to about 1.1 lakh in a month ago. And the percentage change over the previous week is also quite striking. 44% change as of Tuesday, but just 9% a month ago. See how significant that difference really is. And the major concern at this point, the positivity rate jumping to almost 8%, way above what the government had targeted to keep it down to just 5%. All right, so that's the overall picture in the country. Delhi and Mumbai both continue to be a great cause of concern. Delhi now had about 5,100 cases in the past 24 hours, which is its biggest single-day COVID-19 figure this year at least. And this comes at a time when night curfew was imposed as well, from 10 p.m. in the evening to 5 a.m. that has been enforced in the capital now. And the solution to it all, vaccines which need to be opened more and more. Now, doctors and experts saying for everybody, but NDTV caught up with the CEO of Serum Institute, Adar Poonawalla, to understand, do we really have the capacity for that?
How stressed for capacity are you presently as far as Covishield is concerned?
Well, very stressed, to put it quite frankly, because, you know, the globe needs this vaccine, and we're prioritizing the needs of India at the moment, and we're still short of being able to supply, you know, to every Indian that needs it. That's why we have these restrictions at the moment, and slowly that will ease as the supply position eases and many other vaccine producers also scale up their capacities. And we hope that along with them, even Covishield will, you know, increase their capacity to 100, 110 million doses a month. But that's only going to happen in the month of June onwards. So that's where we are at the moment. And we're working with the government. We've submitted proposals to try and work with them, and they will hopefully financially support us also to build more capacity. And that's where we are at the moment.
In terms of more capacity, what exactly is it that you're looking for? And I ask this because there was that devastating fire a couple of months back. As I understand it, some of your capacity was hit over there. Is that what you're looking to overcome now?
So the filling line, one of our additional filling lines was damaged, and that has taken 2 more months to come online. That's why we've pushed the April-May deadline to sort of June-July. But before that, we need to make the bulk drug substance, for which we need to sort of commandeer another building and facility where we're making other products. That is the proposal we've submitted to the government, to see if they can financially support us for the capex, at least for that facility, or we would have to then go to the banks. And we're exploring all the options because we remain committed one way or another to supply, you know, the additional quantity and scaling up by June, July. So this is the situation we're in at the moment.
All right, and taking the stock of COVID situation was also Health Minister Harshvardhan, who reviewed it with at least 11 states and health ministers of these 11 states. He said since February 2021, these states have witnessed a steep increase in cases, majority of which have been reported in the younger population between 15 years to 44 years. Remember, this is something NDTV has been highlighting constantly now, how the second wave has actually impacted the young in the country the most. In fact, it's not just the young and adult youngs, but the younger population between 15 years. In some states, we are seeing it go down to 10 years as well. He also said, and I quote from that since February, these states have been witnessing a steep rise. There is no vaccine shortage in any part of the country. The country is providing required quantities to all states and union territories. Meanwhile, AIIMS has stopped routine walk in the OPD registrations, including a special clinic from Thursday onwards. Only those with prior appointments will be allowed. This decision was taken to minimize the possibility of community spread of COVID-19 and optimization of resources for treatment of COVID patients. A statement said, and I quote, in view of increased need of minimize possibility of community spread in the ongoing COVID-19 pandemic and also to optimize diversion of available manpower and material resources for the care and treatment of suspected confirmed patients of COVID-19. And it's not just Delhi, it's not just Mumbai. In fact, all of NCR at this point, which is in the clutches of COVID-19. The number of COVID-19 cases in Gurugram is five-fold than what it was just 3 weeks ago. That's what the number of active cases are saying, at least. And this in the middle of March, when it was just above 500. Active cases at the moment are beyond 3,000. The total number of cases reported in the district at the moment about 64,500 and over 360 lives lost.
We have the Chief Medical Officer of Gurugram, Dr. Virendra Yadav, with us to talk about the concern, all the preparations by the government and what are the measures that are being taken. Sir, how concerning is this rise in the number of active cases, because it generally puts more burden on the healthcare infrastructure?
Definitely, if you see in the last 15 days or so, or rather than 15 days or so, if I say from the 10 days or 7 days itself, if you remember on last Sunday, the COVID cases of the country were around 50,000 per day. And suddenly we have witnessed up to maybe more than 1 lakh. So it is not only the district or the state, but the whole country is witnessing a surge or a spike. And which was expected, at least in this part of the country, post festive season, not only this part of the country. If you remember, during Diwali, same thing has happened. And in Indian culture, I don't know, the whole country, travel a lot during these two festivals only. And it has definitely caused a surge. Maybe some sort of nature of the virus and the cycle, it has also caused but this time the rise or the spike or the speed is much higher than the last one, if I say. And initially we were having, you were saying about 15th of March and 500 cases, active cases in Gurgaon. At that time we were getting only 20 or 30 cases per day. Now on the last week of March, it was around 200, 250. Suddenly it became 300 to 400. Now we are getting almost around 600 cases. So definitely the surge is there, spike is there, and the number of active cases, definitely it is bound to rise. But in coming time period, if the spike is controlled or the surge is controlled, these will decline, the number of active cases, because they always like 7 to 10 days in the recovery phase. So number of cases, active cases, we see suddenly rise. But our main motto and aim always, not only for Gurgaon but for the state and for the whole country, our motto should be the case fatality rate should be less than 1. Right. And still Gurgaon, we were able to manage till date, if I say from the COVID time period to till date, it is less than 0.6, it is around 0.5 only. The fatality rate, despite being around 65,000 cases, total cases in Gurgaon, the fatality has never been more than 0.6 in Gurgaon.
All right, but let's shift our focus to Maharashtra. And remember, I told you there was a meeting that took place between the chief ministers and health ministers of these 11 states with Dr. Harshvardhan, where the Maharashtra health minister let him know that COVID had impacted their medical infrastructure heavily, and he requested the centre to take out a notification to let neighbouring states provide oxygen to Maharashtra, since Maharashtra is facing an acute oxygen shortage as well. And this is what Aditya Thackeray also tweeted later, saying, this evening I held a detailed review meeting with the city, suburban collectors and municipal commissioners, AMCs, DMCs, ACs of Mumbai for our COVID response management, and we see an exponential rise in COVID tests, cases and hospitalization. The second wave is much stronger. While our test, tracing, fumigation is on autopilot mode thanks to our frontline workers, doctors, we are looking to increase the bed capacity once again to nearly 23,000 beds with enough oxygenated beds. Likewise, have an exponential rise in ICU beds as well. And ICU beds and oxygen, which is in short supply. The bed allotment process in Mumbai has streamlined over some past few days, at least, by the civic body to avoid any confusion or chaos at hospitals, which has seen a 300% jump in the admissions over the last few months, according to the doctors. NDTV Saurabh Gupta reports from the BMC war room.
As there's a rush for beds amongst COVID-positive patients, there's a centralized system that's been set up by the civic body in Mumbai, the BMC, to allot people beds so that there's no crowding, there's no chaos at hospitals. Now this is the war room in the K East ward of Mumbai, where anyone who's tested positive, the BMC gets the data first. Also others who've tested positive and are still looking for a bed could call the war room directly. Someone here will receive the call and accordingly a bed will be allotted.
24 ward war rooms running 24/7 in Mumbai. If you need a bed, the ward war room is where you need to call.
We get line list, positive patient line list twice a day from ICMR. Morning list has come and now bed allotment is going on. As per Municipal Commissioner, Honorable Municipal Commissioner Mr. Chahal sir, he has come out with a circular that any sort of bed booking has to be through war room only.
This ward war room also handles the airport, and patients tested at the airport are also allotted beds.
Once the patient calls here in war room, my teachers take down the case history for them. Okay, we get all the data. They come to me, and we do the triage for the patients.
Like Europe, South Africa, Brazil, they come to airport, and after that we quarantine them to the hotel facilities for 7 days. After 7 days we do their test. On the 7th day itself, whether their report comes negative, then we advise them to for next 7 days for home isolation, and if it is positive, we directly shift them to the hospitals.
Depending on the specific need of the patient, a bed is allotted, or they are advised home isolation or home quarantine, whatever may apply in their case. And that's how actually the BMC's bed management is happening centrally in Mumbai at a time when there is a rush for beds. In Mumbai with camera person Sanjay Mandal, Saurabh Gupta, NDTV.
And Karnataka is in the grip of a second wave of coronavirus and has been ramping up its vaccinations. Testing remains a crucial element in the battle against COVID. But as tests increase, the system faces a huge challenge with actually analysing the reporting and sample collection as well. Maya Sharma has more.
The Karnataka government's KC General Hospital in Bengaluru is one of the places where testing of COVID samples is done.
We'll get the samples from BBMP and elsewhere, about around 800 to 900. Totally about 1000 samples will be coming. For that we need some more stops, some more materials, and round the clock service should be available to test and give the reports as early as possible.
Right now though, no sample testing is happening here at all.
Only testing has been stopped in our lab because of already our people have infected. But swab collection is continuing in KC General Hospital, and the swabs are at present we are sending to Jayanagara General Hospital.
Lab testing of swabs has been facing challenges like this across the state. Over 21 million tests have been done in Karnataka since the start of the pandemic, including over 17 million RT-PCR tests, so the scale is enormous. The government insists it's only communication about negative reports that are delayed.
If any person is being tested positive, the positive cases are reported. Positive reports are being reported within 24 hours. What is being delayed is the negative test reports. Because of the workload, they are not able to give within 24 hours about the negative results. That is having a little delay, which I think within this week we will sort out that issue as well.
Challenges are on all fronts as Karnataka deals with the second wave. With Maya in Bengaluru, Bureau Report, NDTV.
Let's shift our focus to UP now, where 30 deaths were reported due to COVID-19 in the past 24 hours. And as this COVID surge gets reported, Allahabad High Court has now asked the UP government that they must explore vaccination for all. The High Court was hearing a PIL related to the COVID pandemic, and they said that deem it appropriate to ask state government to check the viability of vaccination for one and all. UP government should examine the viability of night curfew as well. All right, with that, we'll slip into a break. On the other side, more news coming in from UP, where this infamous gangster turned politician Mukhtar Ansari has been brought to jail amid tight security. We'll bring you the details on the other side. Welcome back. Mukhtar Ansari was brought back to the Banda jail early Wednesday morning after spending over 2 years in Punjab prison. That's what the police said, acting on a Supreme Court order that Uttar Pradesh police took the custody of the BSP legislator. He's an infamous gangster turned politician, and look at the tight security amid which he was finally brought to Banda.
किसी प्रकार की कोई समस्या नहीं थी। काफी लोगों ने सहयोग किया है। जो हमारे कर्मचारी अधिकारी लगे थे वो भी काफी मानसिक रूप से तैयार थे। इसी वजह से हम लोगों ने सुबह चल के इसको आज देर रात्रि में लाकर
Bangladeshi author Taslima Nasreen faced a backlash after a controversial tweet on the English cricketer Moeen Ali, in which she said that if Moeen Ali were not stuck with cricket, he would have gone to Syria to join ISIS. Now, after the tweet, the cricketing world came to rally around Moeen Ali. And then came this tweet by Taslima, where she says that after the outrage, she actually deleted that tweet and put out a clarification, saying that haters know very well that my Moeen Ali tweet was just sarcastic. But they made that an issue to humiliate me because I try to secularize Muslim society and I oppose Islamic fanaticism. One of the greatest tragedies of humankind is pro-women leftists support anti-women Islamists. With that, another break. When we come back, we'll bring you all the latest on the COVID figures. The next story is going to shock you and move you. It's coming in from Indore, where a policeman assaulted brutally an auto driver allegedly for not wearing a mask. Look at these visuals now, where you see police officers mercilessly beating up the auto driver, all because he was not wearing a mask. And what you hear there is a child pleading the cops not to hurt his father. Disturbing indeed. I spoke with Anurag Dwari to understand what exactly happened.
Yes, a man in Indore was severely beaten up by two policemen, allegedly for his failure to wear a mask properly. This guy, Krishna Kher, a 35-year-old auto rickshaw driver, had slipped down his nose when he was on his way to meet his ailing father in a hospital. but then two policemen caught him on the road and demanded that he come to the police station. When he refused, they started beating him up, and a cell phone video taken by a bystander shows them kicking and punching the man mercilessly as he lay on the ground trying to shield himself. His young son, who was accompanying him, kept screaming for help. The assault took place in the middle of a road in broad daylight, but the bystanders stopped there and clicked photos. No one came to help him. The two policemen, Kamal Prajapat and Dharmendra Jat, were identified, but initially no action was taken. Only after the video was circulated widely, they were suspended and sent to the police lines.
All right. Amid rising coronavirus cases, many students who have been appearing in class 10th and 12th examinations are now demanding cancellation of the offline papers or a postponement at least to start with. Saurabh Shukla has more.
The second wave of the COVID pandemic in India, a big worry for 16-year-old Aryan Kohli, a student of Delhi's GD Goenka Public School with his class 10 board exams, likely a pen and paper affair just a month away.
जैसे आजकल कभी भी फीवर हो जाता है तो लगता है कि अब तो कोरोना हो गया, तो एग्जाम्स को लेकर तो यही है कि डर तो बना हुआ है, हर जगह जाओगे कहीं भी जाओ आजकल डर तो लग ही रहा है, बट एक मजबूरी है कि बोर्ड्स के एग्जाम है तो देने पड़ेंगे.
Like Aryan, his parents and lakhs of other parents and students across the country are worried too.
हम एज अ पेरेंट बहुत ज़्यादा वरिड हैं, बच्चे बहुत चिंता है हमें इस चीज़ की कि कैसे होएगा. अभी बच्चे के प्री बोर्ड्स हो रहे हैं, अभी स्कूल में प्रैक्टिकल्स हुए हैं, फाइनल प्रैक्टिकल्स. डर लगता है कि बच्चा प्री बोर्ड देने जा रहा है. हम भी डरते हैं जब घर आता है वापस, चलो अब तुम जल्दी से नहा लो, हाथ धोए, सैनिटाइज़र साथ भेजते हैं. अब वो चीज़ें कितनी तक उसको बचाएंगी कह नहीं सकते.
क्लासेस तक बच्चे ने ऑनलाइन लिया और हर बच्चे ने पढ़ाई ऑनलाइन करी है, तो फिर ऑनलाइन एग्जाम कराने में क्या प्रॉब्लम है?
The big question, would an online examination have been better this year? And could the government have readied infrastructure for a virtual exam across the country? Last year, while exams in some subjects for both classes 10 and 12 took place, others had to be called off as the pandemic raged. After the Supreme Court intervened, assessment for students was done by taking an average of already conducted exams.
Most difficult part in this whole scenario is that the students like Aryan, they are taking double pressure, the pressure of board examinations and apart from that, pressure of COVID as well. So now they are expecting government to do something about it. Maybe they're suggesting an option, online examination, though now ball is on the court of government, though as of now, government is going to go ahead with offline examinations for both. In New Delhi, with N. Ravi, Saurabh Shukla for NDTV.
And everybody is talking about vaccinations and when perhaps it can really open up for everybody. Well, NDTV spoke about this to the CEO of Serum Institute, Adar Poonawala, to try and understand what exactly was there a delay first up. And what about questions about the efficacy of AstraZeneca against the new mutant strains that have taken over the country? Here's what he said.
How effective is Covishield against the UK variant? I ask that because one only assumes that it's a UK variant. It's certainly there in Punjab, that's a fact. The genome sequencing is happening. If it is there in other parts of the country, this is something that people would want to know.
So let me try and answer your question in a way that we're able to see the real results of this vaccine's efficacy. You know, there's been a lot of talk about different vaccines having 70%, 80%, 90%. By what is it? Then is it on the intervals? Is it more effective with 3 months, 2 months? So the proof in the real efficacy is when you give, as I've always mentioned, millions of people the vaccine across a region or a territory. Now, if we look at India alone, forget the other countries for a moment, we have supplied, as I said, more than 100 million doses, most of which have been only the first dose injected into human beings. The claim of the Oxford AstraZeneca vaccine of being 90 plus and in some countries 94% effective against hospitalizations has been validated because not only is it the Scottish Public Health and the UK Public Health that have put this on their websites, but it's visible now even in India. If we were to go and have a look at everybody in India who has admitted themselves for COVID-19 disease, hardly any of them have taken the vaccine. And if they have, it might be around 5%, which means that 95% of people who have taken the vaccine have experienced COVID disease, but not had to set foot into a hospital and experience severe disease like going onto a ventilator, having your life at risk and all of that. So this really is very good data and proof that, this vaccine, and it's a big relief to all of us, that, ultimately the real acid test is, does it prevent hospitalization? And the answer is yes.
Okay, so that's good news. So essentially, let me just to try and make sure that I'm getting this right. You are saying that the drug will protect you from hospitalization or serious illness if you contract any strain of COVID. And I asked you about the UK strain. Is that what you're saying?
Well, so far, this is what we are seeing. And I don't want to make any off-the-cuff statement that, against the South African strain, UK strain, it may be as good and protective. But so far, we have seen a lot of the UK strain enter India. We've seen a lot of people who have taken the COVID vaccine and still get infected with the UK strain, but we've seen they have been largely asymptomatic, which kind of sort of validates what I'm saying here. But again, if you asked me this question in January of this year, I could not say this with confidence. Today, we're able to say this against the original Wuhan strain, and as time goes on, if you ask me the same question in 2 months' time, we will have had enough experience of Covishield in other countries and in India to say how well it's working toward the South African strain and the UK strain.
Right.
And there's reason for us to believe that at least against severe hospitalizations, our vaccine should be very, very good. Now, is it going to be 94, 95%? I don't know. But, it's not that it's going to have a very mild level of protection. It's going to be good protection.
What about altering, changing the vaccine itself to cater for new variants? Is that something that AstraZeneca Oxford is looking at?
So we're looking at two things. Not only tinkering with the vaccine to be even more receptive to the South African and other virulent and other mutant variants.
Yes.
But we're also doing trials to go under the age of 18, which is something everyone has been waiting for. Pfizer and other companies have already started showing good data for their vaccines at the lower age group. So we're doing trials to demonstrate both efficacy against these mutant variants and in a lower age group. I would wait 6 months at least before we can say it's safe and effective for these two new sort of areas that we're looking to cover.
When I was in Pune and we spoke last time around, you'd spoken about the promise shown by several other vaccine candidates that you were developing. Could you tell us a little bit about how things have changed in, let's say, the last 2 months since we did speak?
So, when we spoke, we were hoping to get clinical trial permissions as soon as January, February, but then that went on till March. And now we finally started the enrollment of Covovax, which is our 89% efficacy Novavax product, which we're very happy to also have them as partners and privileged to be able to make that product. That will go on till the better part of September, October, as I recently announced, to be licensed in India, but we could perhaps look at an export-only license for that candidate even sooner than that period if, we get such a permission from the WHO. The other candidates like the Spy Biotech product also is completing phase 2, phase 3 overseas. We won't do a trial of that probably in India at the moment. I don't think there's any plans for that. And Codagenics, which has finally started the phase 1 product trial that we're conducting ourselves, being our product in partnership with them in the UK. So that has started as well, and we'll see how that progresses. But I think Codagenics is probably the only vaccine we would be licensed in 2022 The other two products, Covovax and the Spy Biotech product, would be licensed at the end of this year. And if we combine that perhaps with also making Sputnik, which we may do, I don't want to announce anything till we have a signed agreement, that may be also an additional product that we make to a smaller extent based on our limitations of initial capacity, which we'll ramp up slowly for that as well.
You let the cat out of the bag, Adar. You let the cat out of the bag. So Sputnik, tell us a little bit about where things stand as far as that is concerned.
Well, you know, RDIF is a good friend of ours. We've been talking to them for many months, and we were waiting for them to also progress, and they've developed an excellent manufacturing technology and platform now. They're very close to being licensed with Dr. Reddy's in India. Hopefully that'll happen over the next 1 month. And then they've partnered with 1 or 2 other companies as well in India. I mean, look, their vision is also to be able to make as much vaccine for the world. And naturally, you know, we are one of the partners that they and I both would be happy to work together. And we're talking about it. Let's see when some agreement actually comes about. But we've had ongoing discussions for a while now. And if we do make it, it will happen this year at some point. I just don't know about the timelines.
Which is the vaccine you are working on, which is a nasal vaccine? Is it Codogenics?
Yes.
And so that changes, that's a game changer potentially, right? And as in the case of Johnson & Johnson, if it's a nasal vaccine, people don't need to come back. You get efficacy within a few days, and that's done. Until you require a booster or whatever, we'll get to that later. So how is that important, you know, for millions, not just in India, but around the world? A single dose vaccine.
So that's going to be a 1-dose nasal vaccine. As you said, game changer. But, you know, that takes a lot more time to develop. We haven't had efficacy data anywhere in the world. We will have to develop that, as I said, from scratch, which we've already started the phase 1. The delivery mechanism also has to be developed in a way that it provides the right amount of vaccine all around your mucosa so that it prevents even the virus, when you get into contact with the virus, from entering your system. So we're hoping that vaccine not only is super convenient to administer, but also may cut transmission when you get infected. That's the whole point of an advantage of nasal vaccines.
Right.
You know, so I hope that more nasal vaccines, we know some others are also developing them. We hope that, you know, we launch those as soon as possible.
Yeah.
And you can watch that entire interview at length at 12:30 this afternoon on NDTV 24/7. Adar Poonawala in conversation with NDTV. Welcome back. Anti-corruption officials have arrested a revenue official and his alleged accomplice after they caught him red-handed trying to burn 5 lakh cash that he had reportedly collected on behalf of that official. Now, the incident happened in Thana Mandal in Nagar Kurnool district in Telangana. The press release from Telangana Anti-Corruption Bureau says that he had trapped after he demanded and accepted a bribe of 5 lakh through a private person at his residence from the complainant. Meanwhile, some good news to actually start your day. International Monetary Fund has upped India's growth forecast to 12.5% this year from the previous forecast of 11.5%. But remember, the forecast was made before India's latest COVID surge, and the global economy is projected to grow at 6% as well in 2021, according to the IMF. We have to start by talking as much as possible about the COVID crisis, really, and that's what the top story is also about right now. And India has reported the highest daily coronavirus cases in the world, and this is for the 2nd day running. Nearly 97,000 new cases were reported in the past 24 hours, and that is a day after India crossed 1 lakh cases mark. This means that over the last 2 days, India has averaged 1 lakh cases per day. Not just the cases, over 440 lives have been lost as well in the past 24 hours, which is down from Monday, but the average daily deaths is at the highest in 4 months. Now, this is how drastically the situation has changed really, and there is about 5.9 lakh cases in the past 7 days compared to 1.1 lakh just a month ago. And the percentage change over the previous weeks is also quite striking. 44% change as of Tuesday, but just 9% a month ago. That's telling you how quickly the rise in cases is actually taking place. The major concern at the moment is the positivity rate that has jumped to about 8%, way above the government's stated target of keeping it well under 5%. And yes, there are hotspots that are being seen across the country. There are cities and states that are a reason of major concern. Let's start by looking at Delhi, which had about 5,100 cases in the past 24 hours, which is the biggest single-day COVID figure this year. This comes at a time when night curfew has been imposed in the capital as well. And then the need of the hour really, vaccines and vaccines for all. That's what more and more doctors and specialists are saying at the moment, and NDTV spoke about it to the CEO of Serum Institute, Adar Poonawala, to understand, is it really possible to vaccinate everyone, or are they really stressed with the vaccine supply?
How stressed for capacity are you presently as far as Covishield is concerned?
Well, very stressed, to put it quite frankly, because, you know, the globe needs this vaccine, and we're prioritizing the needs of India at the moment, and we're still short of being able to supply, you know, to every Indian that needs it. That's why we have these restrictions at the moment, and slowly that will ease as the supply position eases and many other vaccine producers also scale up their capacities. And we hope that along with them, even Covishield will, you know, increase their capacity to 100, 110 million doses a month. But that's only going to happen in the month of June onwards. So that's where we are at the moment. And we're working with the government. We've submitted proposals to try and work with them, and they will hopefully financially support us also to build more capacity. And that's where we are at the moment.
In terms of more capacity, what exactly is it that you're looking for? And I ask this because there was that devastating fire a couple of months back. As I understand it, some of your capacity was hit over there. Is that what you're looking to overcome now?
So the filling line, one of our additional filling lines was damaged, and that has taken 2 more months to come online. That's why we've pushed the April-May deadline to sort of June-July. But before that, we need to make the bulk drug substance, for which we need to sort of commandeer another building and facility where we're making other products. That is the proposal we've submitted to the government to see if they can financially support us for the capex, at least for that facility, or we would have to then go to the banks. And we're exploring all the options because we remain committed one way or another to supply, you know, the additional quantity and scaling up by June, July. So this is the situation we're in at the moment.
And you can watch that full interview in detail at 12:30 this afternoon. That's Adar Poonawala in conversation with NDTV. And of course, COVID-19 situation in at least 11 states extremely worrying. That's the reason why the Health Minister Harsh Vardhan took a review meeting with the Health Minister of all these states. And he went on to emphasize that these states have witnessed a steep increase in cases, majority of which have been reported in the younger population. And look at the age bracket over there. The Health Minister is now pointing out that most COVID cases in the country are now spreading between the age of 15 years old and 44. He also went on to say that there is no vaccine shortage really, but and the centre is providing everything they can to the states and UTs. Let's go across to Sukirti now. to try and understand this in a bit more detail. So, Kirti, this meeting happened in the run-up to the meeting that the Prime Minister would also be holding with the Chief Ministers of all these states, in fact, of all states and union territories across the country in just a few days from now. But I think very important that for the first time, government has acknowledged that the second wave has actually touched upon and infected the young in the country the most. So far, we thought it is young adults, but now even kids increasingly, 15-year-olds getting infected.
Well, yes, absolutely. This is the meeting was held in the run-up to the meeting that will be held tomorrow evening around 6 or 6:30 p.m. between the Prime Minister and Chief Ministers of all the states. You were right that this is the first time that the government has admitted that the infection is spreading faster and faster to that 15 to 44 age group, because so far we've always said that when it comes to COVID-19, it is the senior citizen age group that is the most vulnerable, but now the cases are spreading in the younger age group more as well. Though of course in terms of deaths, the age group remains the same. They are saying that it is the around 60 age group where deaths are higher. But yesterday, the health minister also pointed out specific states for things that had gone wrong. When it comes to Punjab, he pointed out that at least 80% of their cases are due to UK mutants. Apart from that, there are local body elections, there are big fat weddings that are happening. Those are one of the reasons why the cases are surging. In terms of the overall picture across India as well, he said there are various gatherings that are happening, social functions, marriages where 90% of the people do not wear their masks. If you look at trains, buses, these are places where their amount of contact is much higher, but even their COVID appropriate behavior is not being followed. He said that it seems like COVID measures have been given a sort of tilanjali, that's the Hindi term he used, but it would mean that people have become completely lax about COVID appropriate measures, and that needs to be corrected ASAP for India to control its situation.
All right, so we wait to hear from the Prime Minister next on what exactly are the measures that are going to kick in, if at all, to try and curb the second wave. Thanks, Kirti, for joining us for the very latest. We're talking about the situation in the national capital. Now it's come to the fact that AIIMS has stopped the routine walks in OPD registrations, including special clinics, from Thursday onwards, and only those with prior appointments will be allowed. Now, this decision has been taken to minimize the possibility of a community spread of COVID-19 and optimization of resources for treatment of COVID patients inside India's most visited hospital. We are talking about the All India Institute of Medical Sciences in the capital. And close to the capital, let's look at NCR, where numbers are again surging. Gurugram, for example, has seen a 5-fold increase in just 3 weeks, with the number of active cases in March, which was just about 500, at the moment sitting at beyond 3,000. At the moment, the number of total cases reported in the district at least are 64,500 and 368 deaths as well.
We have the Chief Medical Officer of Gurugram, Dr. Virendra Yadav, with us to talk about the concern, all the preparations by the government, and what are the measures that are being taken. Sir, how concerning is this rise in the number of active cases, because it generally puts more burden on the healthcare infrastructure?
Definitely, if you see in the last 15 days or so, or rather than 15 days or so, if I say from the 10 days or 7 days itself, if you remember on last Sunday, the COVID cases of the country were around 50,000 per day. And suddenly we have witnessed up to maybe more than 1 lakh. So it is not only the district or the state, but the whole country is witnessing a surge or a spike, and which was expected at least in this part of the country post festive season. Not only this part of the country, if you remember during Diwali same thing has happened. And in Indian culture, I don't know, the whole country, what should I say, travel a lot during these 2 festivals only, and it has definitely caused a surge. Maybe some sort of nature of the virus and the cycle, it has also caused but this time the rise or the spike or the speed is much higher than the last one, if I say. And initially we were having, you were saying about 15th of March and 500 cases, active cases in Gurugram. At that time we were getting only 20 or 30 cases per day. Now on the last week of March, it was around 200, 250. Suddenly it became 300 to 400. Now we are getting almost around 600 cases. So definitely the surge is there, spike is there, and the number of active cases, definitely it is bound to rise. But in coming time period, if the spike is controlled or the surge is controlled, these will decline, the number of active cases, because they always like 7 to 10 days in the recovery phase. So number of cases, active cases, we see suddenly rise. But our main motto and aim always, not only for Gurgaon but for the state and for the whole country, our motto should be the case fatality rate should be less than 1. Right. And still Gurgaon we were able to manage till date, if I say from the COVID time period to till date, it is less than 0.6, it is around 0.5 only. So the fatality rate, despite being around 65,000 cases, total cases in Gurgaon, the fatality has never been more than 0.6 in Gurgaon.
We looked at Delhi and NCR. Let's look at Maharashtra now, one of the most impacted states with COVID-19. Now, the health minister of Maharashtra, while he was on a video conference with the health minister at the centre, Dr. Harsh Vardhan, requested the centre to take out notification to let neighbouring states provide oxygen to Maharashtra. Now, Maharashtra is facing an acute oxygen shortage, and its neighbouring states can give it oxygen as well at this point, should help in it. In fact, Aditya Thackeray also tweeted about it, saying that he held a detailed review meeting with the city suburban collectors, municipal commissioners, and for COVID response. And he said that while they are seeing an exponential rise in COVID deaths and cases and hospitalization, the second wave is much stronger than the first. And while test and tracing, communication, all of that is running on autopilot, what they're struggling with is bed capacity, which they've also managed to increase to about 23,000 beds. And they need now, what they really need is enough oxygenated beds. And where they are seeing an exponential rise, really, people being admitted more and more on ICU beds over there in Maharashtra. Let's go across to Saurabh Gupta now, joining us for the very latest. Saurabh, no good news this morning, really, when it comes to numbers. And Maharashtra really struggling now. It is the oxygen beds as well. Yesterday we did a story on how there was a lack of blood as well. What exactly is the situation, and who can step in? When Maharashtra says they need help from neighbouring states, what exactly are they asking for?
Well, you know, if you ask for the key thing that Maharashtra and specifically Mumbai is asking for is please open up the vaccination for everybody. In this second wave, what you're seeing is younger people are the spreaders. Younger people who haven't been vaccinated, who are going out, who are carrying the infection from place to place. So the key thing is that, and you know, this is something the Chief Minister has written in a letter to the Prime Minister, that please bring down the age of those who can be vaccinated so that the primary spreaders of the infection can be vaccinated. And that is key to tackling this wave of COVID in Maharashtra, because at this point the focus is on vaccination. Now, apart from that, what can we do? Well, of course, increasing bed capacity. Oxygen is something that's important. Blood supply in blood banks is falling short. So increasing bed capacity can be done exponentially. But what you can't do exponentially in terms of increasing is healthcare staff and healthcare workers. Now, what the government is saying and what we've been reporting yesterday, in fact, we were at a COVID center yesterday, Seven Hills Hospital, where the dean there, Dr. Balakrishna Adsul, told us that, you know, they will have, once the final exams end this year, at the end of this month, they will have around 1,200 doctors joining, you know, several hospitals. These will be fresh pass outs. So they will also then, of course, you know, that'll help them in increase the capacity. But given the numbers we are seeing in the second wave, and it's much more, you know, sort of hard hitting in terms of the healthcare system, that the key is vaccination, and vaccinations need to be opened up and increased to more people, especially lower age groups who are the primary spreaders.
All right, so thanks for joining us. So with that, let's take it forward with our guest this morning. We've got Dr. Avinash joining us from Maharashtra. In fact, he's the former president of the IMA in the state. We also have Dr. Rajesh Chawla joining us from Indraprasth Apollo Hospital. Dr. Avinash, to you first. We know that the IMA has written a very strong letter. They have urged the Prime Minister to actually open up vaccination for all. What we've also heard yesterday is the Health Ministry saying very categorically that at the moment they will give it to those who need and not who want. Can I ask you a straight question now here? That do you think it's a great oversight by the government right now to ignore the young people who are getting more and more infected in the country? We have to prioritize them. If not that, another suggestion that came in from the Maharashtra Chief Minister actually, and quite a good one, is what I'm hearing more and more from experts, that those hotspot districts where the chain of virus has to be broken, at least prioritize them if you don't have enough supply as of now.
Yeah, is right. Actually, right from the beginning, if you see in this second wave, the main infected class was the age of 20 to 45 years old. And because these were the people who were the earning population and they are going out daily for their work and they are getting infected. Most of them were not diagnosed. So they were undiagnosed positive patients like carrier and were spreading the disease not only in the community as well as in their families. So this was the thing that they should be vaccinated first, right from the beginning. It is rather seen that unnecessary these classes are made that 60 plus, then 45 and all those. So since we want to vaccinate all Indians, everybody above 18 years old, so not only 20, we should keep it, rather we should make it open to all the people who are eligible. Right now this vaccine, all above 18 are eligible, so why not make it rather open to all? And especially the population which is exposed to this infection, to the epidemic, is mainly the 20 and 45, the earning group. So we must give, we must allow them for vaccination. So immediately it should be open to all age group above 18.
Right.
That is one thing.
In fact, that's what the US has done now. Joe Biden has said that very soon, I think from next week onwards, is when United States will be opening up its vaccination for everybody above 18 years of age. In fact, April 19th, we are putting out that tweet for our viewers as well to look at as well. Let me get in a word from Dr. Chawla over there from the National Capital. Dr. Chawla, you know, so far in the series of programs, and I've been speaking with a lot of doctors across the country, and a lot of them repeatedly telling me how the second wave has impacted the young more, and of course there are various reasons for that. We heard Dr. Avinash talk about how obviously these are the earning population. These are people who are in buses, in trains, and in metros, in cabs, and that's how really the spread is happening. But I fail to understand how kids are seeing a major spike in the second wave, and is that something you're witnessing in Delhi as well?
You know, the basic thing is that these younger population are going out, they are earning less than 45 are the one, as you just heard, they are going out. Now, this younger population doesn't get much symptoms. They may have just mild symptoms or they may be asymptomatic. Now, when they come home, they spread to their elders, they spread to the kids as well. And because it is opened up, people, the normal working, so naturally it is, you know, if you see the pandemic, how it behaves, this is a normal pandemic behavior. It is never a one surge. Pandemic always has one or two surge or three surge, and then so this is a natural history of pandemic. And
so
it
we
is
knew about this.
augmented
We should have
by
been prepared, right?
the festivals
can I just
which we have.
interject over here and say this? We knew this is how the pandemic behaves. We should have prepared ourselves better.
That's correct. You know, the other thing which about vaccine, can I comment on that?
Yeah, please go ahead, sir.
You know, the basically why the elderly and all these, because the death rate in that 45 and above and the comorbidities was high. That was the purpose. Now they are increasing in stepwise manner. The basic thing is that they need to increase the centers, the amount, so that this younger population can be, because now the government wants that nobody should die. That's why the elderly, because they only die. The younger population, it's pretty safe. But now these younger population is working and bringing back home. So it is important they should increase this center, they should increase the vaccine, so that, like they are saying now in Delhi, that night also they will do, but the amount and the center should increase, and it should be opened up for the younger
You're saying
population.
more centers for vaccination should actually open
Vaccination
up, and that's how
and
you're
more
going
vaccine
to reach
available,
everyone.
so that the younger can also be given.
All right, in fact, let me just get in a last word from Dr. Avinash over there then. We're talking about how more and more younger population is getting COVID positive. But is it true that more and more of the younger people, fitter people with better immunity are actually landing up in ICUs as well? Because the second wave, I don't think it's more lethal. It's not taking so many lives, at least so far. But it is a stronger virus. It's a stronger double mutation that we are dealing with.
Yeah, that is also correct. If you consider the younger population, we are rather observing that many younger people, 20 years and above, are having comorbid conditions. Many of them are hypertensive, diabetic nowadays. And for last few years, we have been rather saying India being the capital of diabetes as well as all hypertension because of many reasons. But that's why they are landing into trouble and getting admitted into ICU because of the complications, as well as many of these younger people, even the children, they are having some congenital disorders, some heart disorders, some kidney disorders. So comorbid conditions are the main thing, and some congenital disorders are also the reason that this younger population is also getting infected and getting complications. One more.
Two messages. Okay, go ahead, sir, please.
Yeah, one thing I'd like to add to Dr. Chawla, sir, that we should not only increase the number of centers for the vaccination, but it should be made open to all clinics and listening. Right now, we have been we have given around 7 to 8 crore people are being vaccinated, and absolutely there are very few complications. So why not make it open to all clinics, all this thing, and it should be made open in the market. So anybody who wishes to take this vaccine can go to his family physician, can go to his clinic, his physician, and take it. So it should be made available everywhere. And the timing also should be available. There should not be any restriction. It has been found that the
That's
center
what
is
more and more doctors
restriction.
are saying right now. But sadly, the government hasn't really agreed to it. We really hope they will listen into these growing voices really. And quickly, as I wrap up and go into a break, a message going out to the young in the country: don't think anymore that COVID is going to come and go like a common cold on you, because the second wave is much more stronger. The double mutation which is out there right now is landing up a lot of the young people with good immunity, even inside the ICUs. To please beware and try and stay indoors as much as possible. With that thought, slip to a break. We'll be back in a moment. Breaking news coming in this morning, where India has broken all previous records of the highest single-day rise in cases. The past 24 hours have given us over 1 lakh cases. 1,15,736 to be precise, is all coming in a span of just 1 day. This is the highest ever we have recorded since the beginning of the pandemic. Sukirti Trivedi with us for the very latest. Sukirti, bad news this is. All right, as we look into those pictures, in fact, those numbers coming in right now, India's highest ever daily case is being recorded now. The past 24 hours have thrown over 1,15,000 cases. And it's not just the cases, mind you, it's also the number of deaths. 360 lives lost in just a span of 24 hours. That's a record, really. And like I said, since the beginning of the pandemic, we have not had such high numbers being reported in one single day. Sukirti Trivedi, I'm told, is now with us. Sukirti, this is really bad news for the country.
Well, yes. In fact, even in terms of the expectations, there were expectations, there was a certain buzz that the cases would be around 1.07 lakh. There were certain reports about that, but it is even higher than that. It's 1,15,000, India's highest record till date, and proves what has been said earlier as well, that India's second wave is proving to be worse than the first one. And that is something Dr. V.K. Paul, who is a Niti Aayog member and also the head of India's vaccine committee, said yesterday, that the steep rise in cases, the pace at which cases are rising, all of that is higher than the first wave, and that is something the center has also repeatedly told the states. And also the number of deaths that we've seen in the last 24 hours, 630 deaths. If you look at just the number of deaths that have happened in the last 7 days, we were around 354 deaths on 31st March, and today the number stands at almost double of that. We saw a little higher deaths on 3rd of April, which was 714, but just in the last 7 days, the deaths have gone from about 350 to around 600 or 700, and that is a very big concern for the government at this point of time, controlling the fatality rate. That is something that all the central teams that have been sent to at least 50 districts across Maharashtra, Chhattisgarh and Punjab, that is what these teams are going to be focusing on, and also the health infrastructure to ensure that the severity of the disease, the patients that are in ICUs, that are on ventilators, they are being taken care of.
Right. So just to put this in perspective for our viewers, as of 7th of April today, more than a year after the pandemic, we are sitting at the highest number we have seen spike up in a single day. The trajectory of that growth, that spike in the graph that you see on your screen right now, is the highest. The sudden spike that you see going up over there, that's the highest. That means we've recorded so many numbers, over 1 lakh numbers in the minimum time really. And then number of deaths also rising. All this is coming at a time when, Sukirti, you've been pointing out, and our reporters across the country also pointing out, that the medical infrastructure is extremely overburdened. Maharashtra, for example, is run out of oxygen. They've run out of blood. They've run out of oxygen beds, ICUs. And more, one of the most emerging trends of the second wave, a second wave which none of the government officials are recognizing as the double mutation being the right cause behind it, but also for the first time acknowledging that the younger population is getting impacted the most, and it's not just young adults, it's children as well from 15 years of age who are now contributing to these numbers, Sukirti.
Well, yes, absolutely. That is something that Dr. Harshvardhan, the Union Health Minister, pointed out in a meeting with the health ministers of 11 states yesterday, that we are not only seeing an extreme surge in cases, but also the fact that most of these new cases are coming up in the 50 to 44 age group. And that is the first admission ever coming from the government side, that it is the younger population that is also being affected. And my colleague Parimal Kumar has also just sent in data of the top 5 states that have been recording the highest numbers. And if you look at the last 1 month for them, there are states like Maharashtra where even children below the age of 5 years, over 9,000 such children have been infected with COVID. Over 14,000 children who are in the 6 to 10 age group. These are not even teenagers, just 6 to 10-year-olds. At least 14,000 of them have been infected in the last 1 month. And there's data of Chhattisgarh, Delhi, Karnataka, as well as other states that goes to prove the same, that these are all below 17 age group, all these children that have been infected in thousands in the last 1 month. So there are multiple challenges for the government at this point of time. One, of course, is the sharply increasing daily deaths in India, and then again this younger population age group. Also, something we want to point out about the state specific scenario. One, of course, is Maharashtra, the biggest concern always. At least 55,000 of the cases in the last 24 hours have been reported from Maharashtra. If you look at a state like Chhattisgarh, this is what the health secretary was pointing out yesterday. It is a very small state if you compare it in terms of population, if you compare it in terms of area. But in the last 24 hours, they've recorded nearly 10,000 cases, 9,921 cases to be specific. That's 10,000 cases at least coming from a state like Chhattisgarh.
Right.
Much bigger states like Karnataka or UP have much lesser numbers than Chhattisgarh.
But important to point out here, Sukirti, there are also states which are testing much less.
Right now looking
For example, UP is testing much less, and that's the reason why we see lesser numbers coming from there as well. So these numbers that we get from states have to be looked in that perspective as well. But for all our viewers joining in right now, India is waking up to its highest ever single day rise since the beginning of the pandemic. In the past 24 hours, we've reported over 1,15,000 cases, and this is bad news for the country. Dr. Yatin Mehta is with us. He's the chairman of Medanta Institute of Critical Care. Dr. Mehta, really it's getting from bad to worse. We are hitting a new peak every day. This is all happening in the second wave, said to be much more stronger in terms of how strong the virus is, impacting the young more, impacting children more. And this is coming at a time where our medical infrastructure is so tired and fatigued of over a year of constantly looking at cases. If you could just point out to everybody listening, what is it that people need to do right now? Isn't it time that we all really put our guards up, stay indoors as much as possible and wear our mask? We really can't stress enough about it.
Yeah, Sonal, you put it correctly. I think the thing has completely exploded, COVID-19, and this peak is much larger. And that whole thing, impression which people had that this time the disease is milder, it may or may not be correct. But the numbers are much bigger, and therefore that means this time the virus is much more infectious. It spreads to more people. And ICUs are getting full. Pune, Bombay have no ICU beds left. I think we have to control this, otherwise we are finished, because vaccination is going to give protection after a while. After the second dose, 15 days after the second dose, the vaccination gives sufficient 80% protection. But that also still leaves behind 20% of the people. So vaccination should not give us a false sense of security. I would advise everybody to vaccinate who is entitled to it. But please, this COVID appropriate behavior must be exercised absolutely. Otherwise, we are completely will be finished. Our infrastructure is not going to be able to cope with this. Every night, and I'm getting half an hourly phone calls of patients wanting to be shifted from other parts of the country to us. And I think we are not able to handle it. We will not be able to. We do not have the infrastructure to cope with this. So people are dying, and the only way is making sensible behavior, distancing, masking, and keeping hand hygiene. So that is what, and not getting into crowds. I think that must be avoided completely.
All right, Dr. Mehta, thanks for joining us with the very latest. India, come on, look at these numbers right now. We are sitting at the highest we have recorded since the beginning of the pandemic. More than 1,15,000 in a single day. It's time we really buckle up and understand how severe the situation is. The second wave is not going anywhere. We are still to hit the peak, and we are recording new heights every day. So come on, do your bit to ensure that you are not contributing to these numbers. We leave you with that thought. Back in a moment. Welcome back. Now, we keep urging all of you to keep your masks on. But look what happened in UP's Azamgarh when a mask-checking drive at a popular market there descended into chaos after cops had an argument with a trader who had allegedly not worn a mask. Mobile phone video shots from a terrace show cops trying to handle this trader, and his clothes are torn into a police vehicle as he resists and protests. Eventually, the police did take him to the local police station, but this angered other businessmen who get out the thana, is where there was some vandalism that took place, and the cops had to use a mild force to disperse the crowds. A senior police official in Azamgarh said that the matter had been sorted out.
वहाँ पर एक व्यापारी से विवाद हुआ और उसके बाद व्यापारी कोतवाली परिसर में आ गए थे। उनके साथ कुछ अराजक तत्व उनके घुले मिले होने के कारण उनके आगे और उनमें डिफरेंशिएट करना बड़ा मुश्किल था। क्योंकि व्यापारी वर्ग कोतवाली मौजूद था और उनसे बार बार अपील की गई थी कि आप लोग अपने आप को अलग कर लें। कुछ अराजक तत्वों ने यहाँ पर नारेबाजी हंगामा करना शुरू किया, उन्हें कोतवाली से हटा दिया गया था और व्यापारियों से बात हो गई है और व्यापारियों से अच्छे माहौल में बात हुई है और हमेशा व्यापारियों का सहयोग रहा है। पुलिस द्वारा भी उनका हमेशा सहयोग किया गया है और सभी व्यापारी घर चले गए हैं और जो उन्होंने एक हमें कंप्लेंट की है, वो कंप्लेंट ले ली गई है और जो व्यापारी था उसका मेडिकल कराया गया है।
A mask-related violence reported in Indore as well, where a policeman assaulted an auto driver allegedly for not wearing a mask. But just look at the way he's been beaten up in middle of a road, and all this is happening shockingly when the driver's son was nearby, and you can hear him plead with the cops that stop doing this to my father. Listen in.
Yes, a man in Indore was severely beaten up by two policemen, allegedly for his failure to wear a mask properly. This guy, Krishna Kher, a 35-year-old auto rickshaw driver, had slipped down his nose when he was on his way to meet his ailing father in a hospital. But then two policemen caught him on the road and demanded that he come to the police station. When he refused, they started beating him up, and a cell phone video taken by a bystander shows them kicking and punching the man mercilessly as he lay on the ground, trying to shield himself. His young son, who was accompanying him, kept screaming for help. The assault took place in the middle of a road in broad daylight, but the bystanders stopped there and clicked photos. No one came to help him. The two policemen, Kamal Prajapat and Dharmendra Jat, were identified, but initially no action was taken. Only after the video was circulated widely, they were suspended and sent to the police lines.
Moving on, anti-corruption officials have arrested a revenue official and its alleged accomplice after they were caught and red-handed trying to burn 5 lakh cash as he had reportedly collected on behalf of the official. The incident happened in the Danda Mandal in the Nagar Kurnool district in Telangana. A press release from the Telangana Anti-Corruption Bureau says that the Tehsildar had been trapped after he demanded and accepted a bribe of 5 lakh through a private person at his residence from the complainant. This was to do an official favour of issuing a no objection certificate and forwarded to the AD Mines Geology for grant of a query lease license for the complainant. Officials say at the time of the trap, on suspecting the arrival of the ACB officials in order to escape being caught, he bolted the door of his house and burnt the bribe amount on the gas stove of his kitchen.